Health experts in Kenya are raising concern over a reported rise in ectopic pregnancies. This is a life-threatening condition where a fertilized egg implants outside the uterus. Tonight, we speak to a gynecologist to understand what's driving this increase and the warning signs women should never ignore. Dr. Simon Kigondu, thanks for joining us.
Thank you.
Dr. Why are we seeing more ectopic pregnancies? Is this in fact the case? Are the numbers truly rising, and what's behind this?
Yeah, so thank you very much for having me. An ectopic pregnancy is a very important topic because it can kill you. It can kill the mother. So the Kenyan population is rising, so we are having more women conceiving. Secondly, we are celebrating Kenya Obstetrical and Gynecological Society at 50 years. Therefore, there are more gynecologists. Therefore, there are more diagnoses because more people are going to hospital. And thirdly, the diagnostic criteria is becoming better. There are more ultrasounds available, and there are more people who know how to do ultrasounds, and the women are also going to hospitals early.
The concern is in the misdiagnosis, so the danger signs to look out for, because this is a different type of pregnancy altogether. A woman feels a certain way when she's expectant. So in terms of this ectopic pregnancy, what are the danger signs that might lead someone that way, just fearing, again, the misdiagnosis as well, and somebody thinking that it's something entirely different?
Yes, actually, an ectopic pregnancy can be missed. So if you look at this picture, an ectopic pregnancy is a growth of a pregnancy in the wrong place. So you're having the egg growing here, the fertilized ovum, instead of inside the uterus. This is the uterus, this is the fallopian tube, and this is so the egg comes here, grows here. So it's supposed to grow here.
It's supposed to grow where?
It's supposed to grow. Normally, a baby grows inside the uterus here because it has moved like this for 5 days and grown here. Yeah. But now, if it grows here, it's dangerous because this fallopian tube is supplied by an artery that comes directly from the outer, the ovarian artery. And once it pumps one, a lot of blood goes in. So
what is a woman feeling at this point where it's at the wrong place?
So two things. One, an ectopic pregnancy, you must be pregnant. So if you miss your periods and you do a pregnancy test, then you're pregnant. If you start having spotting, a bit of bleeding, not too much, as opposed to a miscarriage, then you may suspect an ectopic pregnancy. So you can do an ultrasound. You go an ultrasound and see the position. So it's in the wrong position. If it grows without being seen, at 6 to 8 weeks, it can burst this fallopian tube and the artery starts bleeding. And that's when you have more symptoms. People can go into shock. You know, you're having internal bleeding, literally, and therefore it's a very dangerous because it can be silent. Then one day you have the symptoms of pain on one side, then you're having dizziness and bleeding. But it can have no symptoms maybe for the first 6 weeks, and therefore the way of detecting it is seeing your gynecologist and they do an ultrasound to see where the pregnancy is growing. So
once you diagnose this as an ectopic pregnancy, what treatment options are available? And because you're talking about, the possibility of it bursting and this extreme pain, what must be done urgently? What care must this lady receive?
Yep. So if the lady is bleeding, then surgery must be done to stop the bleeding. So a lot of the surgery can be done. So there are ways of doing the surgery where you can do an open surgery. You do almost like a cesarean section. Go in, look at the tube and where the ectopic is, clamp it out, and maybe remove the tube. If it hasn't burst, there are two ways of going about it. If it's small, there is some medicine that can be given to shrink that so that it doesn't damage the tube. But if it's too huge, then you may have to do some surgery. But the gold standard, so to speak, is minimal access surgery called laparoscopy, where they put a camera at the umbilicus and small surgery equipment where you can remove it without having too many cuts as it does. So surgery, and if it's caught early, then you have some medicine called methotrexate that can be used.
Now, Dr. finally, the elephant in the room, and I looked at a study from the Aga Khan University Hospital, which shows that indeed these pregnancies are on the rise, but the causes and what must change immediately. I saw causes such as the IUCD. I also saw the emergency contraceptive pill being one, and then also looking at the age group of 35 and below. So in terms of this not being a normality, what must change immediately, and what are you attributing to amongst some of the factors, of course, and maybe others that I haven't mentioned?
Yeah, so the two most definite, so to speak, causes. First, a lot of women would have ectopic without any risk factors. It can happen. But the two most common risk factors are pelvic inflammatory disease, which are infections which are caused by sexually transmitted diseases like chlamydia and gonorrhea. So the first thing, avoid these illnesses. The second one is surgeries, repeat surgeries. Like if you had an ectopic in one, you are at risk of another. Emergency contraception and the coil, which are used for contraception, are not causes of ectopic pregnancies. But you can imagine those who may conceive on emergency contraceptive or pill are actually sexually active. So they may also have those other risk factors that are there. So to avoid ectopic pregnancy, the biggest intervention is to prevent sexually transmitted diseases which go and block the tube a bit, and ectopic pregnancies, and that is the most effective approach of doing that. The other one is to see your gynecologist early so that they see where the pregnancy is, so that in case there is an early pregnancy, it does not destroy your tube. We can use medicine to treat it.
Dr. Simon Kigondu, thank you very much for your time.